When we started this, the goal was, let's start with impact in mind. It wasn't the traditional way of starting a business, which is start with the exit in mind. How can we make as much money as possible, shortest amount of time as possible?
I like, of course, how you live in such a place of like expense management, expense control, and then I'm just like terrified of not enough revenue.
So you have even increased cash outflows. Yeah, you have like 3 more bad months. You're tanked. You're out of the, you're going bankrupt.
All right, we're back here, episode 2, Inside Ava Health. David Purinton, CFO, partner at Ava Health, and I'm Christopher Bennett, CEO. Love being here with you. We're going to just dive straight in. Business of Behavioral Health, the new weekly series here. Let's get into it.
Let's do it.
Mission and margin are inseparable at Ava Health. What does that actually look like in the decisions that we make together?
Yeah, coming right out at it. Let's see. What does mission and margin look like? There's so many different ways that you can look at this. It's like a kaleidoscope here. One way that I would look at it is when we're making decisions, we're not necessarily making decisions that, well, let me put it this way. When we started this, the goal was, let's start with impact in mind.
Right.
It wasn't the traditional way of starting a business, which is start with the exit in mind. How can we make as much money as possible in the shortest amount of time as possible? It was, how can we reach the most people and make the biggest impact amongst those folks and the family and their families and the communities that they live in the shortest amount of time? And so everything we've done from day one has been about building scale. Will X, Y, or Z work at scale? And it even sounds weird to say like that we're thinking about scale in mind from day one, because that can get so tweaked into thinking about like just the margin side of the equation. Will this be cost efficient at scale, or will we need to hire 15 new FTEs in the back office to be able to support that project or initiative? Whereas the way we're looking at it is, will the impact still be there at scale? In other words, are we freeing up time from folks in order to be able to spend more time with the patients, more time with clients, more time in the community? How do those like early decisions actually work? And so you can't do that if you're overspending either. I mean, that's just a kind of hard truth of where it can like look like some decisions are being made from a margin perspective. But the way we're approaching it is saying, that could work with, a census of 30 or 40 people, but will that like actually work on a margin perspective with a census of 200 people, or will we become insolvent? And so I think that was like one of the main it continues to be one of the main frameworks through which we make decisions. And it just comes down to sustainability. Like, can we continue to support doing this, this organization that we're building, at a census of 50 or 150 or 250. And if an idea won't scale, then we've got to figure out a new way to do it. So that's, I'd say, like a big lens through which I see margin and mission. But another lens, even stepping back further from that, is just the idea of sustainability in the first place. Margin for the sake of profits distributions to shareholders is just margin. Margin for the purpose of ensuring that we're going to stay afloat if and when Medicaid cuts take effect and start to hit behavioral health and rural providers. We're Medicaid and rural. That's margin and mission. That's like sustainability in mind. If we're looking at margin just for the purpose of, again, profits distributions to shareholders, then that's just margin. If we're looking at it for the purpose of how do we ensure that like our staff feels valued through revenue sharing plans, through raises, through flexibility, through systems that actually work,
Right.
That allow them, that free them up to actually spend time with patients, which is why they got into behavioral health in the first place. That's margin and mission.
Yeah. I know it's such an interesting like mission equals margin margin equals mission, right? And so from day one for over 2 years now, we've had this conversation about we can't actually create the impact that we want to create, right? Which is to live in this world where adaptable and accountable and accessible behavioral health care is a universal right, right? So accessible and easy and low barrier and all of this, if we're not making money. And if we're not making money, there's no way to do this. And there's no way to do this without this, right? And so when I think about it, obviously you and I both come from a very strategic lens and a very vision-oriented lens. I think it's one of the reasons our relationship works so well is we really are able to think out, in the future and how, as you mentioned, the decisions we're making today about systems and processes and technology and how are the things that we're implementing today going to work at scale to then allow for more impact, for more margin. That's where they become so inseparable, to your point. And how can we, it's the old adage, but I think we've taken a different spin on it, which is how can we do more with less?
Mm-hmm. Yeah.
And typically that's like a really bad thing when people say that,
especially
right?
in this industry.
Yeah.
It's like, wait a minute, so you can make more. It's like, no, hang on.
Right. We're going to give you more responsibility. We're not going to pay you more. We're going to ask you to do more, but there's no upside for you, whatever it is. And it's like our ability to look at how to create sustainable, a fiscally responsible and sustainable financial position and impact at the exact same time, right? Like that's how it starts to feel like all the decisions we make are really through these two lenses. It's not just how do we decrease expenses, but also looking at when we decrease expenses, what are the levers that are occurring on the other side, right? What is the impact of a decrease in expense here or an optimization here, right? What does that actually do to the culture, to the care that's delivered?
Well, yesterday you and I were having a closed door conversation strategy meeting, and we talked about, in behavioral health, it's the adage is always, this is a business about that really consists of buildings and people. And if you get the buildings right, you're halfway there. But then you also got to get the people aspect right. And a lot of folks look at that from just purely the lens of staffing patterns. What's the most efficient staffing pattern that we can get for our nursing and our therapists and counselors and our techs and et cetera? We have a third piece to this where we're saying it's about business, it's about buildings and people and tech. And this tech piece is important. You talked about this from day one. We're going to be a tech company. And kind of early on, it was like a little, not goofy, but I'm just like, wait a minute, like explain this. We're not a tech company. We're a behavioral health company. But yeah, I think that really encapsulated this idea that we can leverage tech in a way that frees up folks' time to spend and deploy that time at what they're really good at, which is spending time with the clients.
Right. And it's such a, right, there's so much conversation right now about AI and automation and, right, there's all these companies coming out with AI therapists and, right, there's a lot of like people that are kind of freaking out about it.
Mm-hmm.
So it's like, just to go a little bit deeper, it's when we talk about the utilization of technology and leveraging the advances that are happening today, we're doing that in the back office, right? So we're not deploying technology in any way that's client facing. What we're doing is saying, how can we create more time for our clinicians to spend time with patients, right? How can we optimize billing practices, right? I mean, a classic one that I'm living in right now is marketing. And we talk about like speed and leverage and these things, right? So how can we do more with less? We can do that through technology. And we've obviously we've come into this in a really good time.
We did.
Right? 5 years ago.
Timing was perfect.
5 years ago, right? We'd already be behind the curve. However, we were able to ride the automation and AI wave, right? Up until kind of where we are right now, which is, pre-launch. And looking at how can we use technology. So we talk a lot about like, when we can shrink our marketing budget down from 20 or 25% of our total OpEx spend, which is probably pretty standard in a startup environment, to we're targeting about 4% right now. We have to be able to utilize AI in different ways to create significant efficiencies, which then now we can deploy that additional 16% of margin into other areas, right? Primarily benefit packages, culture, salaries, new technology that helps our clinical team, right? So it's like,
Yeah.
this is all like kind of centered in that dialogue around mission and margin, right? And being able to be forward thinking enough, right? But still really rooted on the ground of like, what do we need to do today to set our team up for success, not only at launch, but a year, 3 and 5 years from now, you know, and being as forward thinking from a technology perspective as we can. I mean, it's where we are right now.
Yeah.
And if we're not paying attention to this stuff, right, providers are just going to get left behind because the speed we're able to execute in different ways, especially from the back office, finance, accounting, marketing, human resources, right? All of these things that have been for so long, so human capital intensive.
Mm-hmm.
Now creating those efficiencies, we go, whoa, now we have this additional margin to play with. And we talk about being a rural Medicaid-focused provider. We need that additional margin to ensure sustainability.
Yeah.
There's no way around it.
And even on the private pay side, it's like we're not coming out and saying it's, $500,000 for care here. We're being very transparent with folks and giving them links to our dashboard so they can see our financials in real time so that they can see what it actually costs to deliver care. And which puts us in a really accountable position when we're saying, here's, it's for X amount of months, the cost is Y. They can now fact check us and see, does it really cost that much? Are you guys just trying to generate a ton of profit and margin there, or not? And kind of doing all this extra work to be transparent doesn't necessarily benefit us in a like a profitability way, but it benefits the stakeholders, which are the referrents and the families and the communities, and it holds us accountable to those pieces. So when we are pulling those levers and saying, oh, cool, we're going to try and aim for, I'd be happy if you said 15%. So the margin is in marketing, but if we're in like the single digit territory, I'm going to go nuts.
Right.
That's kind of unheard of.
Yeah.
And you talk about that lever, like, cool, we're going to save the money here. Now we can deploy that into benefits packages, which makes our staff feel really comfortable and safe and secure so they can show up to work and give their best day in, day out to clients. That's what we're doing. I mean, it's the levers. And so going back to mission and margin, it's if we can increase margin by freeing up time so that we don't have a ton of back office folks in accounting or billing, or so that we're not spending all this money on the marketing side, then the lever is now mission and we can deploy it over here.
For sure. And it brings up kind of the lead into this next topic I want to chat about, which is, you think often, right? CFO, their favorite word is no.
Mm-hmm.
CEO, the favorite word is yes. So there's going to be like this natural kind of tension that occurs, right, in our relationship and our roles. So like, where is that healthy for the system? But also, like, how do we make sure that that tension strengthens and doesn't fracture the mission?
Good question. It's a hard question to answer. The reason why I'm thinking about it a lot is because we are very aligned. You and I think about things very similarly, and so does Ian. He definitely has a different side on the ops that you and I are a lot more like strategy and vision oriented. But we've both seen, I don't know how many hundreds of sets of financials and operating models of other behavioral health providers, which gives us this kind of shared perspective that you do have to control expenses. That's a kind of a crucial piece of leadership. When folks come and say, we need, $10,000 for to refurnish this house. No, we just did that a couple of years ago. We got to save that money for other things. Like, bad example, but you get the idea, and we share that. So it's hard for me to answer that because I don't feel like there's a lot of friction that you and I have. I know that day will come. The one example I can think of that just kind of comes to mind right away was actually this podcast studio when you said, hey, I need, a budget for this. And I looked at the budget number, and it actually isn't even that much, but I looked at the budget number and I'm like, wait a minute, like that's like, I think it was like $15,000. I'm like, we need to deploy that on other things. And the result was you came in way under budget. So first of all, I was pretty happy because then we were able to deploy that savings on a new water system up at the homestead. And then secondly, I'm looking at the result of what you guys produced here and what you continue to produce, what we're even doing right now. And I'm like, why didn't I think of that? That was a brilliant idea. It's a way to save money on all the gas and plane tickets and all that stuff and actually reach people, show them our heart, show them who we are, be transparent, and have a reach that we actually wouldn't even be able to have by spending thousands of dollars a month on plane tickets and hotel rooms.
Right. You are right that we are super aligned, and I think that it's one of the things that I sometimes wonder, like, man, how do David, Ian, and I get into more like conflict?
Yeah.
And we talk about like conflict here, like being healthy and right. Like it's a search for the truth and right. What is the best answer and asking the right questions and really challenging one another. But you speak to, well, first off, let me give a quick shout out. Roman, good job. Good job on the studio, my man.
It's beautiful.
Yep. So I'd love to take any credit. I had nothing to do with this except for saying that looks really good. Good job. So, Rome, my man, good job. Also, my sister helped out. There you go, Laura.
Taylor.
I think that the way that it strengthens us is
why did I say Taylor? Lauren. I don't know why I said sorry. Lauren, LB Designs. I'm going to give you a shout out now. LB Designs killed it with all of our facilities. So that was my bad. I don't know why I said Taylor.
Hey, who knows? Who knows? It's the meeting you got this morning.
Yeah.
But I think that so what's interesting, right, is you'll go into like expense control, right?
Mm-hmm.
And really like talking expense, right? And being so granular and nuanced on the expense side, right? And then my like true fear is related to revenue, right? And every time that either I've been a part of something that has like really gotten into a bad place or seen these other companies, right? That again, like having consulted and having, kind of a behind the scenes look at a lot of companies in behavioral health over the last, 15 years is so much of it comes down to revenue. Right. And so like my fear, right. And I think this is like one of these nice balances in our relationship is that like you're very focused obviously on the expense control, the expense management, right. Seeing the huge picture on the decisions we're making and the investments we're making today and how those are going to impact us today and in a quarter and a year. And then I just live in this place of like revenue's king. Like I get so terrified of not having the revenue. And so I think that like, that's also that, yes, we are incredibly aligned when we look at the models, when we think about patterns, when we think about expenses, when we look at projections, all this. And yet I still think like you're on the more conservative side, just in general, which obviously I think is a good place for our CFO to be. But then I'm constantly looking at revenue, right? And just looking at like, what do we need to do to maximize, right, our reach, the trust that we build in communities, the transparency, the accountability, right? And yes, we get to use this studio and this format to reach more people than we ever would with me getting in a car and driving up somewhere and meeting with 6 therapists. And yet revenue is always the thing that terrifies me about behavioral health businesses. Because it's just, you watch companies grow, and they continue to expect the revenue to continue to pace.
Yeah. And
then all of a sudden there's a hit, expenses have risen to a point, right? And you get into a really sticky situations when revenue drops and expenses are increasing. Which again is business 101, but it's just something that I like, of course, how you live in such a place of like expense management, expense control. And then I'm just like terrified of not enough revenue.
So I hope that any other behavioral health CFO that's out there is going to really like hone in on this part right here. Okay. What I think, correct me if I'm wrong, I'm sure you've seen this though. Like we haven't actually talked about this and we're talking about it in real time live right now, but I can almost guarantee that you've seen many companies out there in this space who you start out of network, right? I mean, that's just the nature of it. Unless you're purely Medicaid focused, you're going to start out of network on the commercial side. And for the first 6-12 months being out of network, you tend to see a lot. I mean, let me even say it like this. The first few months out of network, it takes like the AR collection cycle, the accounts receivable cycle is really long. Your days receivable outstanding is going to be 6 months, maybe not quite that long, but it's going to be like a long, prolonged period. Then you start collecting, and it's not just about what we call Cadillac policies out there. It's about that the payers at first will fund those out-of-network policies quite well. And so you start to generate this like budget based on outsized revenue being out of network. But over time, those same payers want you to move in network. Anthem's notorious for this one. Right around the 6 to 12 month mark in that window, the out of network reimbursements start dropping. And their goal is to push everyone in network. So if you stay out of network for 2 years with Anthem, you're kind of not really doing yourself any favors, nor your patients are going to have to foot deductibles. You might as well just move in network. The problem is that you've developed your budgets off of outsized revenues. And so when you move in network and now your reimbursements drop, your margin's minimal. I mean, we go back to margin of admission. If you have 2 bad months in a row, you're going to go take out a loan. And if you have another 3 bad months in a row, now you've also got the drag of cash flow from the interest and amortization on it if you did am it. But so you have even increased cash outflows. You have like 3 more bad months. You're tanked. You're out of you're going bankrupt. What we did was we started from day one saying if we were only seeing folks with Medicaid policies, what are the budgets that we have to live and die by? And we created it with that 15% margin in mind. That's a safe one. 10% is really not enough margin to survive. Again, you have a few bad months in a row, you're in trouble. So we developed all of our budgets with that in mind. And so then when it goes back to your concerns about revenue, I think your concerns are about how much of the payer mix will be Medicaid versus commercial versus private pay, which can obviously increase our revenue amounts and therefore increase our margin, which we can then go back and grow, obviously take care of our employees with bonuses and things like that. I don't have that same concern because I know that we developed our budgets based off of Medicaid style revenues. And secondly, you come down to this cash reserve ratio. And so you look at your total expenses per month and how many months you want to keep in cash. And the industry average is, 1.5x. Not necessarily that people want that, but it just sort of ends up kind of what it is. We're looking at 2.5% because we always want to make sure that we have enough cash in the bank no matter what happens. If we had some, God forbid, an audit that, we have to go for 3 months without actually being able to collect on any of our reimbursements, that we'll survive. We'll make it through that. So I have less concern on the revenue side than I think you do. And I also have full trust in you. So I think that's also probably part of it.
Well, it's interesting because I actually think what it is for me is it's past stuff, right? It's past stuff and thinking about growth and scaling quickly, growing quickly, and then being fully out of network and working with private pay, right? And that is a totally different strategy on how to connect with people, attract people, treat different people, right? And yet, as you're saying it, it's like in the moment, I'm going through my own process going, yeah, we actually have nothing to worry about, right? We have positioned Ava Health in a place, Grand Junction, Mesa County, the Western Slope, where literally like certain levels of care we provide that we know are necessary here don't exist.
Yeah.
Right? Like, so there literally isn't another option
Yeah.
for high intensity outpatient formulate PHP. Like, the service doesn't exist, right? ASAM 3.1 transitional housing
That one's wild that it doesn't exist out here.
does not exist, right? So, and when we think about like the need, right, it's more or less probably going to be, hey, we're going to be open on X date, and right, the wait list starts, and like we're never worrying about it. I think over time, and you brought this up as well, the interesting mix is, yes, all of our modeling is based on 100% Medicaid census, really long AP cycles.
Yeah.
Excuse me,
AR cycles.
AR cycles. Is that, you know, as we potentially increase to a little bit of commercial in-network, working with Aetna and United and BCBS and whatever it is, right, you start to generate a little bit more on top of those Medicaid rates, you know, a few in out-of-network policies, a little bit more, even private pay. And again, we'll publish our rates. We've not taken our Medicaid rates and then done 3x is our private pay rate. Like, they're all fairly comparable. And yet what that does is start to shift to a little bit more margin, which then we can look at, again, reinvesting back into the business. And so as you say it, it's like I don't have revenue fear, but for some reason in that moment, I was feeling that like, you know, we do have a full continuum. I mean, we got 30 plus res beds and acute beds, and we've got a 27,000 square foot outpatient space and 48 transitional beds. And right, like, you got to do some pretty good admissions work there to get that thing up and running and full and consistent and all of that. But as you were speaking, it's like, yes, sometimes I have to go back to the fact that we're not focusing on private pay and out of network. And we've created the model that is fully sustainable with good margins simply by working with the need in our local community, which is primarily Medicaid. We're good. So it's just interesting to even like walk through that with you and be like, oh yeah, like that's some old shit I'm carrying.
Yeah. And we know that it will come to the commercial private pay side, because what we've experienced is that there's a tremendous value in a milieu when you mix people from all sorts of different socioeconomic backgrounds. A lot comes out of that. And so we know that that's going to be a value proposition to folks wanting to come to Ava Health, that they can be a part of that. And I don't say that in any kind of corny, salesy type of way. We've actually seen that.
Sure.
Our own experience suggests that that's a better milieu than one that's just purely folks who have the resources to come up with private pay rates.
Yeah, 100%. So, I mean, we've talked a bit about transparency and building in public, and we're here and we're having live dialogue about this. How do you think this idea of transparency and accountability and being in public and building in public makes us better leaders?
Keeps us accountable, right? Like we've talked about, if somebody has a dashboard to our live financials. Now, again, like, let me just be clear. It's blind in the sense that you wouldn't be able to click in and find any patient data, or, you know, see like, oh, my buddy Jimmy over here, I just found out he's making 80 grand a year, and he just told me like I had to pay for dinner last night. You know, like, what are you doing, bro? It's blind like that, right? But you can see, you know, how we're spending the money, how much it actually costs to deliver care. And you can see it in real time. You can see blind aggregated data on operations and what's going on in the milieus, what's going on in the outcomes. You can see all that data. And so we can't just go out there and tell some story about how great we are, or about, you know, well, it actually costs us $80,000 a month to deliver, you know, this level of care, when they can actually get on and see for themselves. So it keeps our story aligned to the truth, which I know I know Rome, I know Ein, I know our whole team, like that's just who we are anyways. We wouldn't go out there and try and bluff that. Honestly, it's like, it's kind of nice to be able to be transparent like that, because it's like, no, we told you like what we say is true, and like we're gonna put the data out there for you to be able to see that. So yeah, I mean, even sharing all that, like it's like a circular reference on myself of like, what's it doing to keep us accountable? I mean, that's sort of our value set anyway, so we would have. But if there was ever a weird day where we wanted to be full of shit and, try and like screw someone over or whatever, we can't, or if we ever wanted to try to hide something, we can't, like we're going to be fully out in public. And that does mean also sharing the failures. And we could try to spin the failures all we want, but there's still going to be failures and people will see that. I also love that though, because we all fail. Like my life story is just failure after failure, but it was failing forward. It was learning from my mistakes, and getting better. And I think there's like a lot of humanness in that. So
There is. I mean, the transparency conversation is so interesting to me, and it's probably it actually needs to be its own Inside Ava Health conversation because there's so much depth to it for me. So I won't repeat what you just said, just say fully agree.
mm-hmm.
Trust has really been broken in behavioral health,
Mm-hmm.
right? So from, I think, really every angle, right? So if we looked at governments, stakeholders, funding sources as one, I think there's a lot of like, hey, like we're giving you guys a lot of money.
Yeah.
Like we're not really seeing a lot of results.
Yeah.
Then you've got like families and communities that are like, hey, we've put our trust in blank provider, blank providers in our community. We're not seeing results. Clients and patients that are wanting to access care are saying, hey, I'm not going back to that place because of an experience. Employees are saying, hey, I've worked at those places and it was traumatizing. I'm not going back. So I think like the foundation of, I'll say one more actually, and then I'll move on, are the referral sources.
Mm-hmm.
So the people that families are going to or communities are going to and saying, hey, I have a loved one who needs help. Where should they go? Can you help me navigate that? That there's been so much kind of shiny object marketing, right? That's been positioned as, right? Like we're the answer. We have the solution. Like, leverage your house and your 401k and get a second mortgage. And like, we're going to solve it and fix it. And right. And so much of like the marketing has been so deceptive, whether that's online or even in person. And yet, so it's like, when I step back and I kind of look at that and like, wow, like trust has just been like destroyed, dismantled in behavioral health. And so if what we can do is get here right behind the mic and we can share this not only referents can look at, community members can look at, our employees can watch, go, dude, like I just learned new stuff about what we're doing in Ava and how David thinks about something, how Chris is seeing something. But longer term, right, this vision of no outside investors, right, and being able to preserve mission and margin at scale goes then to the funding sources where we can then say, hey, look, we know, and we know this from actual evidence and experience, providers are not sharing information with you. They're not sharing financials with you. They're not sharing outcomes with you. They're not being able to tie that you provided X funding and here was the result, like here was the ROI on that funding for you. So like positioning ourselves from day one to be able to walk into conversations, again, kind of with all of those different people and say, look, like this is who we are. We're going to say like, we're figuring it out. We run into challenges. Sometimes we do well. A lot more times we do things that don't work, but we're constantly sharing all of that with you to create trust again and to be like the trusted provider. So if someone says, man, I'm working at Ava Health, right? That's like with a thing of excitement and joy. Like a friend of theirs is like, oh, I need to come work there, right? I want to be seen, valued, heard, paid well, good benefits, like put in a position with the systems, the processes, the technology to actually show up and work with clients and not have 40 people on a caseload. And right. And so to me, like transparency And I think why it's so important and why it continues to make me a better leader is it continues to keep this like very myopic focus on how do we continue to build trust with everybody that ever comes across the Ava Health brand, right? And it like doesn't even matter what your lens is, right? Like governments, stakeholders, funding, families, communities, but everybody is seeing the same thing and going, what I see on their website is what I see them talking about. It's what I see them delivering. It's what I see when I go there. It's what I see with this. It's what I see with social media. Like it's just a picture of Ava Health, and hopefully over time just continues to just be like fundamentally rooted in trust.
That's a beautiful framework. My framework is so much more like an Excel spreadsheet.
Typical.
Yeah. And I would just put it like this. It's like when we look at I think the fear of the industry going towards value-based care. I think it's a lot of they don't want to be open kimono, for one. And they also don't know how they're even going to produce these metrics, these capitation metrics in the first place. I look at the capitation metrics and I'm like, that's it? Like, dude, we're for free. We're good. We're just like going like 10x that. Like, not like saying that like we're, I'm not promising the results of our metrics
Sure.
to be 10x that. I'm just saying like being able to demonstrate the data in the first place. Far deeper, far more rich data sets than what any capitation metric would ever hold us accountable to.
Yeah. Well, look, this is the beginning of a very long journey. We've been on it for 2 years together at this point. I look forward to the next couple of decades and many, many more dozens of times sitting across the table, just being real and connecting and letting people in.
Yeah.
And letting people behind the scenes and really inside Ava Health. So I love you.
Love you too.
Thank you for everything you do.
Likewise.
Stoked that you guys joined us today.
Yeah. Thank you.
Like, comment, subscribe, smash that like button, and we'll see you next week. Peace.
Later.